Right, okay, you. So we're nearly done. I'm just going to wind things back a bit to a point we touched on before, right near the start, when it comes to eating disorders and disordered eating. Um, to anybody who's watched this or listened to this, who's a parent, who has a teen, preteen, or into those years, who suspects or is pretty adamant that their child is going into that realm, again, what would be your advice as the qualified professional? How do you think would they be best to approach it?
It's tough. I think I'm not a parent, so I can't put myself into that situation. I think if you're ever unsure, there's a really good website called Beat. It's beat.org.uk, BEAT, and they have fantastic advice for parents or for people going through this journey, whether it be disordered eating or eating disorders. And I would recommend parents especially go on to that, because I think they have downloadable resources. So does Mind UK, they have some good downloadable resources. Cool. And I think the best thing that you can do is encourage two things. One, the way that you treat yourself, your body, your relationship with food is such a model for how your children do this. And this is certainly not a blame situation of if your child is experiencing this, it's your fault. It's not. But there are certain things you can do for yourself where you don't call foods good and bad. You don't talk about dieting in front of your children. You don't body check all the time and measure yourself and weigh yourself every day in front of your children. And children are very perceptive. They don't just have to, it doesn't have to be blatant for them to pick it up. They might see that your partner always compliments on your body and you get really happy about that. So they learn that actually body compliments are a really good thing. Or if your partner says something negative about your body, how that impacts you. So moving away from talking about your body, your partner's body, your child's body, other people's bodies, commenting on other people's looks in any way, let's try and move away from that. And I think the second thing is making sure that you create a space where you can have these conversations with your child, and so that they don't grow up thinking it's normal to always be dieting. So they don't grow up thinking that they can't talk to you about, maybe they feel embarrassed because they ate something. Like if you feel ashamed for eating a biscuit, then they're going to feel ashamed for eating a biscuit. So it's about having these open conversations, I think, as best as possible, which I know is difficult if you've got a 13-year-old girl who doesn't want to say anything. Sure. But creating even these conversations with your partner where your children are around so that they can kind of get involved in them indirectly, I think is quite helpful.
Hi, thanks for watching this clip. If you enjoyed this content, click here to watch the full unedited version of this episode.